So I'm Bruder Stapleton. I'm the chair of the Department of Pediatrics and the Ford Morgan Professor of Pediatrics at the University of Washington, and also the Chief Academic Officer at Seattle Children's Hospital. I'm also a pediatric nephrologist, which is my true love. My life's been greatly influenced by my parents and my family, who were teachers and incredibly supportive, and who really inculcated in our family a sense of service to the community and also fairness to everyone in our community. And I, as a young person, worked with children, and in medical school found that children and working with children offered so many opportunities to create a future for our patients. And I came to Seattle as a pediatric intern and resident at Children's Orthopedic Hospital following medical school. And here I was inspired to pursue a career in nephrology by Dr. Robert Hickman. And that has really shaped my life completely, because kidney disease adversely affects particularly minority populations. And so through my work, I really found joy and value and challenges in trying to help children from underserved communities who had kidney disease. When I first started in taking care of children with kidney disease, there was no dialysis and transplant, so all our efforts were to prolong life before they died. And during my lifetime, we've started dialysis and transplant programs, and I've had the opportunity to initiate some of those programs, starting first in older children and then ultimately taking care of babies and infants with kidney disorders by dialyzing and ultimately transplanting them. Because of the many questions around kidney disease, I became interested in research. And through my research programs, I found a lot of joy, and I began developing research programs. Although I found terrific joy in my individual research programs and taking care of individual patients, I realized that by building bigger programs and leading broader initiatives, I could have a bigger impact, and really found a lot of enjoyment helping other colleagues develop their careers. And so, wanting to have that bigger impact both in research and in my clinical care, I became interested in being a department chair. And I first was a department chair at the University of Buffalo and Buffalo Children's. And there I had some wonderful colleagues and realized that two things. One, women in medicine were underserved, and we started programs for leadership for women, and also that we really did not have a diverse workforce. And so one of the things I accomplished in Buffalo was to have a National Institute of Health grant where I brought 25 minority students to Buffalo every summer and placed them in laboratories and gave them an initial experience in medical research. Coming to Seattle was an incredible opportunity for me to kind of return to my very roots in pediatrics, and also to come to a place that has this wonderful commitment to take care of any child who comes through our doors at Seattle Children's, and also a philosophy: if there's a good idea, let's see if we can make it happen. And it certainly has allowed us to do that during my time here. Starting with research programs that have developed in a really significant way, and also to begin to understand how we can create a more diverse and inclusive workforce and clinical and research programs, so that while here we have really emphasized recruiting the best. We are committed to excellence here, and you cannot be excellent unless you have input from every member of our community, and we can't serve our community unless we know their needs, we understand their values, and respect those communities in everything that we do.